I asked ophthalmologist Dr. Natasha Herz to explain why routine eye examinations are so important.
So when somebody comes in to have their eyes checked, they're not always aware of the total health of their eyes. They may just be coming for an eye checkup. But a full ophthalmic eye exam includes checking their medical history, seeing if they're at risk for anything that would affect their eyes, such as diabetes or high blood pressure, and what medications they're on. And then I start the exam by checking their acuity. And I want to know what their best vision is. So if they have glasses, I'll check their vision with their glasses on. And then sometimes, even if their vision isn't 20/20 with their glasses, that has to be adjusted before we move on to the next step. So after their acuity is checked, then I will check their pupils to see if those are reacting properly, because that shows me how healthy the optic nerves are and some of the other pathways, the neurologic pathways. I'll check their visual fields, which is the peripheral vision, their extraocular movements to make sure their eyes are moving together and working together. I'll also look at their external appearance to see if any of the eyelids are droopy or if one eye is protruding further than the other or any other sorts of abnormalities there. And then I'll look at them with a high-powered microscope called a slit lamp, and that helps me to see the structures in the front of the eye in great detail. And then after they're dilated, I'm able to see through their pupil with that same microscope to look at the nerve tissue inside the eye, including the optic nerve, the retina, the specialized portion of the retina called the macula, as well as the blood vessels. And then finally, I do check eye pressure as well.
Wow, that's very thorough. Now, a lot of people wear glasses. Talk to us about refractive errors. Explain them for us.
So people will commonly say that they're nearsighted or farsighted. And nearsighted means that you can see up close without your glasses. And farsighted means that you can see far away without your glasses. And usually those people are lucky enough that they can see at all distances without glasses, because they can usually focus through farsightedness if it's a small amount and not need them, at least when they're young. So, and the medical terms for nearsightedness is myopia, and for farsighted is hyperopia.
All right. Now, are you able to explain with your little eye model there what myopia is?
So myopia is when the eye has too much power in the optical system, so that when the light rays come in through the pupil, they end up being focused in front of the retina, and you want them to be focused on the retina in order to have a clear picture. When the eye doesn't have enough power and is farsighted, that means the light rays come in through the pupil and would be virtually in focus behind the eye. And if the eye is able to strengthen itself by increasing the power of the lens, which you can do when you're younger, it will bring it into focus then on the retina.
So that's why people with that farsightedness might feel eye strain, because their muscles are working a little harder all the time.
That's right, that's right. And as they get older, they will feel it more, so that they do begin to need glasses.
Right. Now, at what age does myopia, the short-sightedness, begin to develop? Or is it there all the time, right from birth?
Most of the time, infants are actually a little bit farsighted. And as they grow and their eyes get bigger, then that goes away most of the time. And in America, anyway, most children, or most people, if they have a refractive error, it's nearsightedness. Between 20 and 50% of the population is myopic. Hyperopia is actually less common in the U.S. It's about 10% of the population is hyperopic. When you do develop nearsightedness, it does tend to happen between the ages of 8 and 12. That's when their bodies are changing and growing the most, and that does seem to be when they come in, noticing that they're not seeing as well at distance.
Oh, so growth spurts happen to the eyeball as well.
Yes. Yeah.
Can anything be done to change the progression, to slow it down? Or?
So with myopia anyway, there are genetic factors which you can't control, but there's also environmental factors that play into it as well. And they have done studies on the populations of more highly educated people, and they noticed that they do tend to be more myopic, so they realized that higher amounts of near work without breaks do tend to make people more myopic. And so they have recommended that recess is good. Taking breaks and playing outside and taking the times so that the eye isn't focused up close so much, that actually can help reduce the amount of nearsightedness.
Right, and so I imagine now that kids are getting into screens, and even babies are using iPads,
True.
that we might be seeing more myopia.
Yes, that's possible. It is possible, and there is certainly a chance that that could cause an increase in the amount of myopia, which is another good reason to limit the amount of time that your children spend doing video games.
Right. Now, what about the sort of the farsightedness, the hyperopia? Does that progress with age as well?
So typically that will show up when a child is young, but most of the time if it's less than 2 diopters worth, which is the normal range if people are farsighted, that it's somewhere between 0 and a +2, they can focus through it when they're younger, and they don't need glasses. But as their eyes age and they get older, they will start to notice that it's harder for them to see up close. That's the first thing that they will notice. And then maybe mid-range, around computer distance, that they will start to have some trouble. And then finally, maybe when they are in their 40s or 50s, notice that they also need glasses for driving, which even though they've made it most of their life without glasses and the nearsighted people needed them when they were 7 years old,
yes,
they're more bitter.
I guess children are more resilient.
Yes. Yes.